The next I'll ask Dr. Andriy Klepikov. We're too familiar from the news with the tragic crisis that has hit Ukraine. And we're honored to have you here to tell us more about your work, your current work. So could you tell us what synergies did you find and use from your existing work with Global Fund Partnership when first the COVID pandemic hit and then the war suddenly started? And how was your organization with the Global Fund Partnership able to continue the fight against the target diseases in circumstances of war and subsequent refugee crises, and to do this with attention to accountability of funds? Thank you.
Thank you. Thank you for this opportunity to share some thoughts. We all remember the challenges COVID pandemic brought to us. With the war, working during the war condition is a million times harder than during the COVID. And when the war started on 24th of February, Global Fund was the first donor, reacted faster and more effectively than others. With additional funding, with the flexibilities, with decision-making done in 24 hours. Reflecting on the similarities with COVID, it's important that we should constantly modify and adjust our services. We should be prepared to unknown. Several things. One is in Ukraine now, we have 15 million populations moved. 15 million, it's a huge number. 7 million out of the country as war refugees, and 8 million within the country as internally displaced people. When such huge population are moving and is mobile population, your services cannot be statical. So it's one critical lesson that we shifted service provision, did it through mobile clinics run by NGOs, with outreach, with going to the territories they occupied from Russians, where the infrastructure is destroyed. So mobility is one lesson, relatively new. The things we brought from COVID times, digitalization, remote service provision, telemedicine, online consultations, and it's critically important that even we have virtual social worker, because sometimes we cannot go physically, but it's critical to maintain the contact with the person. So digitalization is a big issue, even cross-border, because for war refugees, sometimes it's critical to develop contacts with the doctors. And it's critical to be built on trust. We had thousands of patients initially lost, and they, from Mariupol, for example, this is a city which became Ukrainian Aleppo, destroyed by 90%. And the first calls, phone calls, patients did were not to doctors, but to case managers and social workers because of the trust and rebuilding these contacts. And another thing, in a wartime context, we know more what a person-centered approach means. We really need to be responsive to the person's needs. So if someone requires evacuation from the battlefield, from the war zone, we do evacuation. If someone requires mental health support, it's important to provide mental health support. Someone requires food, we cannot just say, sorry, we have condom for you. It's important to find a way to provide, bread to the person. So in this time, in this context, flexibility is critical. And another thing I would like to say is that civil society really became the partner to the government. With the Global Fund support, we did a lot. Just one example, factory producing opioid agonist treatment, methadone, was destroyed in Kharkiv. Government couldn't do procurement so quickly. So with the Global Fund, we did this procurement. Then Ministry of Health said, sorry, our logistic company refused to implement contractual obligations. There are drivers afraid to go to the areas affected by the war. So civil society, my organization again stepped in, say, we will do delivery of all medicines, and we did with no treatment interruption. So it's important lesson also for other players, like with IRVs, Global Fund brought all stakeholders at the table, and PEPFAR did emergency procurement of antiretroviral treatment. And it was also delivered by civil society. And we have to be innovative. For example, with TB medicines, when we delivered initially by vans, there was a fuel crisis. So we shifted to bicycles and delivered TB medicines and collected sputum with the bicycles. If there will be no bicycles, we would walk. So it's important not only due to motivation and resilience from civil society, but also for all these investments Global Fund did to communities and civil society over the past 15 years. Thank you.
Thank you very much, Dr. Klepikov. We stand with you.